Hey there, it's Chris Connell. You are looking at deciding whether or not you want your state health benefit plan offered to you or not. So here's what we're looking at. When you go to the state health benefit plan site and we go to plan documents here on the homepage, click that. We go to the summary plan document descriptions. We can see all the plans that you're being offered right there, right? So, what we want to know is what are some of the details? We're taking look, this most popular one, the Anthem one, I think uh, they give you two basic choice: United Healthcare and Anthem. But here's what we want to see: both of them have some similarities, and that is that they've got costs built in that you need to know about. So let's take a look. So this is the details of your plan for the Anthem plan here. And what I'm looking at is maximum out of pocket. So I want to see what the maximum out of pocket is on these different things. See what you have to pay. So number one, it's a red flag here for me, is for inpatient hospital care. So for inpatient hospital care, you owe 20% coinsurance per admission. 20% coinsurance per admission. So you have to pay 20% of the cost. Up to how much? Well, up to $2,340 for the first 1 to 8 days. So you got to pay 20% of your hospitalization cost up to this amount. If you reach that amount, then they start paying, after that. But you got to pay 20% up to that. So even if you're going to go with this plan, at the very least, you need a copay protection standalone plan that I could help you with that would cover you for that amount. It would give you that money so that you could pay for that coinsurance cost. So if you're going to stay with this plan or any of the union provided plans, they've all got this. The United Healthcare plan has that same provision that you got to pay 20% up to $2,340. So that's a chunk of money to come up with out of the blue. That's a hole in this coverage. We can plug that hole with a standalone out-of-pocket protection plan. It doesn't cost very much, and so that's one way to go if you're going to stay with your insurance provided plan here. So let's look at some other maximums. So your hearing aids limit to a maximum $1,000 every 4 calendar years. You get $1,000 total for every 4 years. That's not great on hearing aids. So if you got hearing aids, that's something you may want to look at. You may want a different standalone hearing plan. And I've got a plan that can take care of that for you. Let's see what other holes it's got here. Eyewear. Eyewear is limited to $125 maximum benefit. That means they're going to give you $125 off. That's all this insurance is going to do every 2 years. They give you $125 every 2 years. That's not a lot. So again, for those of you who have eyewear and you break your glasses or you want to get some new glasses, $125 is not much. So I have a standalone dental vision hearing plan because I don't think this plan gives you any dental at all. It's light on eye care. It's light on hearing care. So you may want to add a $35 a month, $37 a month dental vision hearing plan to this plan to plug that hole if you keep this route. What other holes have we got here? Let's see. So this is your annual out-of-pocket maximum. This plan has an out-of-pocket maximum, as all Advantage plans do. Though this is an Advantage plan. Out-of-pocket maximum is $2,500. Now that's lower than most of the Advantage plans that you don't get, that you get on the street. You know, your union has negotiated this down to $2,500 for your benefit. But that's still a chunk of money. What does it mean? You have to spend you have to spend $2,500 out of your pocket on copays before this plan then pays everything after that. So it's nice that it'll pay everything after that, but if you get to $2,500 in copays you've racked up for the year, that's a lot of money. So that's something to be aware of. If you go a different route, if you elect not to take this plan and go on your own to get a supplement plan, for example, this isn't something you have to deal with or worry with. Supplement plan doesn't have a max out of pocket. It covers you 100% from day one. You don't have any co-insurance you're paying for that hospitalization co-insurance. None of that. It pays 100% of all your bills. Doesn't have any of this stuff. So that's something to consider, especially if you're paying for this, because a supplement plan, is going to cost you $100 a month or less. Most of you are paying more than that for this plan, which doesn't even cover you at 100%. So I know the union thinks this is the best thing since sliced bread, but not from where I'm sitting. I see some holes in it here. So here's another thing you should be aware of here that's a hole in this policy, and that is right here. This is a big deal because this is an advantage plan, and all of them have this provision: prior authorization required, asterisk. Some services fall within the category will require prior authorization. Based on the service you're receiving, the provider will know, blah, blah, blah. This means an approval in advance is needed by your plan to get covered services. Blah, 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 blah. Medical services are covered only if your doctor or other network provider gets prior authorization from your plan. So in the end, this is an advantage plan. And one of the basic components of an advantage plan is prior authorization is required for services. So even though it's provided by your union, it's still an advantage plan. It's got some lower copays, but it's still an advantage plan. So it is possible that you could want some services that are denied. That is not possible if you go the other route for a supplement plan. There's no prior authorization required when you go the supplement plan route. But if you go this route, that just know that this is right here in your policy all throughout it. One of the things also it's going to have that all advantage plans have is regarding cancer. Cancer, you're going to have to pay 20% of your chemotherapy costs. Let's see here. Hold on just a second. Let me find that. So here it is right here on page 46 of the PDF. When you download that document yourself, you see it right here. So regarding cancer, you've got a 20% co-insurance for chemotherapy drugs right there. So you need a cancer plan if you're going to have this policy, because the cancer plan would give you a lump sum of money if you got diagnosed with cancer, and then you'd need that money to pay for these co-insurance costs. So again, that's not the case on the supplement plan route, but it is. So this is just one of the holes that's in this policy. Not saying it's a bad policy, but I'm saying it's got some holes in it. So you either need to add some components around it to plug these holes, which I can help you with some other standalone policies that'll plug these holes, or you can go the supplement plan route, which is a more comprehensive route and does not have all these holes, and it doesn't have the prior authorization requirement and those other things. So this is my assessment of the state health benefit plan offered retirement plans from Anthem and United Healthcare. Not terrible, but you can improve it by plugging some holes or saying no thank you and going the supplement plan route. Reach out to me for more specifics.